Hello, and welcome back to Hagan's New Jersey PIP Tips, where we bring you monthly segments on New Jersey auto insurance personal injury protection, otherwise known as PIP. Happy Valentine's Day. I hope this video, along with my others, will help you fall back in love with New Jersey PIP. Today we're going to be covering the healthcare primary, where an insured selects healthcare as their primary beneficiary on their PIP. Additionally, we'll be highlighting Spine One Chiropractic Center, who was selected from last month's drawing, and of course we'll do this month's drawing for next month's video. So without any further ado, let's get to it. So let's talk about healthcare primary. For those consumers out there, I suggest you check your insurance policy to see if you have health insurance primary. This isn't an election, meaning the standard is PIP primary. And what the difference is who pays first, the PIP or the health insurance. If you selected health insurance primary, that means your health insurance is going to pay the bills first and then PIP as secondary. I suggest you check to see if you have it, because chances are it's really not saving you much money. I've seen cases where it saves as little as $15 over 6 months to then have to jump through additional hoops and hurdles with your health insurance before you can even get to the PIP insurance. Additionally, many plans will also have a lien against the lawsuit against the other driver who caused the accident. So even if you recover against the other person, the medical expenses paid by the health insurance will have to be paid back. Depends on the type of health insurance. So be careful if you select this, and only select it as a last resort. Now, if you're a medical provider or even an insured and you're involved in a motor vehicle accident and you're told it's healthcare primary, here's a few suggestions and what you should be doing. First, get a copy of the declaration page and make sure it indicates that it's healthcare primary. Typically, it's right under the PIP section, which is usually the second or third coverage listed on the declaration page, and it'll say health insurance primary. Sometimes it's buried at the end. Just because an insurance carrier tells you healthcare primary doesn't necessarily mean it's healthcare primary. On that deck page, it'll also tell you what your policy limits are. The standard is $250, but it could be down as $15, and also what your deductibles are. So check all three. Next, ask the patient or yourself if you recall ever signing a coverage selection form electing healthcare primary. Again, this is an option that must be selected in writing on a coverage selection form. If it was not done, it can't be healthcare primary. Also, just because you check the healthcare primary, if you don't list the health insurance, the insurance carrier is under an obligation to follow up and make sure your health insurance can cover it. So an example where it would never cover is if you have Medicare or Medicaid and you list that as your insurance. It's an invalid election because it can never be selected as primary. If you're not sure, ask the insurance carrier for the copy of the coverage selection form that was signed and make sure all the facts are correct. If the insurance carrier does produce the coverage selection form and it's properly filled out and it's properly signed, again, look to see if there was health information put in there, such as a policy of Horizon. If it wasn't, it's an invalid election and we can choose to refute that. Now, if unfortunately you do have a healthcare primary and you need medical treatment due to a motor vehicle accident, there's certain steps you have to follow. In all likelihood, you'll still have to let the insurance carrier know, your PIP carrier, and they will send you a decision point review plan. In most cases, you're going to have to still follow that decision point review plan, meaning making requests for pre-certification, giving them notice of the claim, filing appeals. The only difference is they will say that the bill should go to the health insurance first. Now, if they tell you in writing that you don't have to follow the plan, or they never send you the plan, then you wouldn't have to follow the plan. Next, in terms of billing, when you have a healthcare primary, you first bill the health insurance carrier. Upon receiving the EOB, the explanation of benefits from the health insurance carrier, if there's any money still due, you then bill the PIP carrier along with a copy of the health EOB. So an example where you would be billing the PIP carrier second is where there's either a copay or they paid less than the medical fee schedule on the PIP auto medical fee schedule. Or perhaps they denied an individual service. Or they might say that they don't cover any type of that care being provided, or that, for example, maybe chiropractic treatment is limited to so many times and it's already been used up for the year. So anything that's been denied or improperly paid, you can then bill the PIP carrier with a copy of the health explanation of benefits. A quick example would be if a chiropractor billed conservative care in excess of $105, and the fee schedule would allow for the daily maximum of $105. You bill the health insurance, let's say they only pay $20 with a $30 additional copay. You can go after the PIP carrier for the difference, both for the health insurance copay along with what was less than the medical fee schedule, the New Jersey PIP fee schedule. So you'd be eligible up to $105 less the $20 health insurance, less than the example I gave was $30 payment by the health insurance. So you'd still be entitled to the difference. They don't get the benefit of the health insurance payments or denials. They must pay up to the amount. Now, some carriers refuse to pay anything beyond the health insurance. They'll say, nope, the health insurance plan is binding and you're not entitled. This is incorrect. The regulation 11:3-37.7 is how to calculate what should be paid by PIP as secondary. So first you determine what PIP would have paid if the health insurance wasn't primary. Again, this is how to calculate it. So you first determine what PIP would have paid if health insurance wasn't selected as primary. Once you come out to that amount, you then look to see what the remaining balance is. If the remaining allowable expense are less than the above calculated, they got to pay the remaining balance. So the example I just gave you, they paid $30, they applied a $20 copay, and they paid less than obviously the $105 daily maximum. So they're going to have to pay the $105 less the $30 to health insurance. So you can't get more than the actual fee schedule. So $105 less $30 is $75. And that's what you should be paid. Now, if the amount that you calculate what the PIP should be responsible for is greater than the allowable amount, then they pay the full amount under the PIP. So for example, if the health didn't pay anything, then the full amount would become due. It's pretty simple, straightforward, yet many carriers disagree with it and try to interpret it differently and refuse to pay. Usually we are successful. Most arbitrators will say that the proper determination, regardless of how it proceeds, is the balance up to the medical fee schedule that's listed on New Jersey PIP. Again, most DRPs agree with this analysis, but there are a few that either miscalculate or misunderstand the law, and so we can't guarantee that it's going to be a win every time. Now, another issue that sometimes comes up with the health insurance primary is where the health insurance doesn't issue an explanation of benefit at all, even though you have proof of billing, or where they deny it for what I'll call an administrative reason. We want the records again. We want the referring doctor's records. We need the separate diagnostic test results. And you never get paid by the health insurance. As long as you have that health insurance EOB with a determination by the health insurance, you can bill the PIP carrier along with that health EOB, and they're responsible. Again, this is something that the insurance carriers, the PIP insurance carriers, will often and sometimes dispute. But for the most part, most arbitrators will agree, if not whether it's been processed correctly in the PIP eyes, but whether you have a healthy EOB that you then submitted to the PIP carrier with the bill. The final issue I say that I'll address that I often see is when the PIP carrier tries to apply a $750 additional deductible. So if you have healthcare primary and you don't have health insurance, the penalty is PIP becomes primary, but you have to pay an additional $750 deductible, along with the carrier's entitled to get the premiums back for the discount. However, if you did have health insurance, but they're just not covering the services, they're not entitled to the penalty. They're only entitled to it if at the time of the motor vehicle accident, you did not have health insurance. The other situation too is you get in a car accident, you have health insurance, but you lose your job a few months later and you lose your health insurance. In that case, you had health insurance at the time of the accident, therefore the additional penalty would not apply, and PIP should be paying. Again, if you have issues with these, always feel free to contact us. I hope that was informative and helpful. Next, I want to talk about last month's winner was Spine One Chiropractic Center. Spine One Chiropractic Center has 3 offices in Atlantic County. They have offices in Egg Harbor, Northfield, and Atlantic City. Dr. Victor Rossi is the director. He is also current vice president of the Association of New Jersey Chiropractors. He's been practicing since 1989. It's a wonderful, caring staff. You can get a same-day appointment almost always, and they try to ensure that. So if you call today, you're probably going to get an appointment today or at least by tomorrow. Again, 3 convenient locations. The offices are very nice. You have private examination rooms, so you're not just in a big group area with other patients. Most insurance is accepted, and they do all the paperwork. So you're not going to have to worry about, contacting the carriers, the health insurance carrier or the PIP carrier, sending in paperwork, etc. They perform various chiropractic and physical therapy modalities and can address your injuries. And they do specialize in motor vehicle accident, in that a significant portion of their business involves motor vehicle patients. It's a wonderful practice. I've been representing them now for close to 17 years. Always a good result. If you need to contact them, you can reach them at 609-965-5533, or you can see their website at wealwayshaveyourback.com. I'll show it here on the screen. And in that, you can go to the contact page where you can put in a digital request. Congratulations again, Spine One, for your great success over the years and being selected for our first medical provider to be highlighted in our video. And now for the drawing for next month. So if you've seen our last video, we switched it up in 2019 so that our monthly drawing for those in the Hagan Professional Information Program, the person selected gets featured in the next month's video like we just did for Spine One. So any kind of communications or correspondence, whether you call us with a question, follow up with information we need, you call us, email us, any type of communication, we enter your name in with a ticket. So for example, demands for arbitration, if you send them, you get a ticket. And then each month we draw someone new. So if you don't win this month, there's always next month, so keep sending your correspondences and demands for arbitration. And this month's winner is... Sean needs a new pair of glasses. No. Northeast Spine and Wellness. Congratulations, Northeast Spine and Wellness. I'll be reaching out to you to get you information and pictures for the next month's video where we'll highlight your practice. Well, thank you for joining us today. Hopefully you found the information regarding healthcare primary useful. If you still have questions, always feel free to call us at 732-722-2911, or you can email me at pipmail@seanhaganlaw.com. As you can see, we work with a lot of great providers, including Spine One Chiropractic Center. As always, we're never too busy for your kind PIP and personal injury referrals. If you found this information useful, helpful, or you really like, please like, share, and subscribe to the links below. Thank you, and God bless.